Today we will talk about how pharmaceutical giants destroyed natural remedies. This is a shocking topic because everything you are about to hear comes from a single book, published almost 100 years ago. The book is called the United States Pharmacopeia, 21st edition, published in 1926. This was not an alternative source. It was the Pharmaceutical Bible. More than 2,400 pages long, it was the most authoritative and comprehensive reference on medicines in the United States during the early 20th century. At that time, 75% of all officially approved medicines were natural. They were made from herbs, plants, animal extracts, and minerals. Only 25% of medicines in 1926 were synthetic, derived from petroleum. Let that sink in. This was official medicine, not folklore, not traditional healing, not alternative therapy. Official, state-approved medicine. Today, we will tell you about 20 of those natural remedies, and what you will hear may truly shock you. From 1926 onward, a slow but deliberate transformation began. In the 22nd edition, published in 1943, the balance had already shifted. Natural remedies were reduced to 50%. Synthetic drugs now made up the other half. Just 12 years later, in 1955, the 25th edition revealed the final collapse. Only 25% of medicines remained natural. The remaining 75% were synthetic, petroleum-based pharmaceuticals. In less than 30 years, natural medicine was nearly erased from official healthcare. We will not go deep today into the full story of greed, power, and control. We will not fully unpack how pharmaceutical empires rose, how the Rockefeller and Carnegie families worked together, or how the Flexner Report reshaped medical education worldwide. But it is important to understand this. Those reforms transformed medicine into something entirely new. Not a system focused on healing, but a system built around pharmacology. And what was lost along the way was nature itself. History has a tendency to repeat itself. What do we see happening again and again? A good idea appears, and then, little by little, something else infiltrates it. In the past, there were only a few hundred medical diagnoses. Today, there are thousands upon thousands, and just as many treatment protocols. Doctors are divided into narrow specialties, and each one treats only a single fragment of the body. You visit a gastroenterologist because of digestive issues. You are examined. An ulcer is discovered. You receive a diagnosis. You are prescribed medication. You go to the pharmacy. You buy the drugs. Later, you return for another examination. But here is a critical difference that is rarely discussed. The difference between natural remedies and pharmaceutical drugs is enormous. Drugs are powerful, but they usually block one single mechanism, one enzyme, one receptor, one pathway. Natural remedies are not as aggressive, yet they create many simultaneous effects throughout the body. There is a concept called medical progress, and many people assume that progress automatically means wisdom. But does it? Or are we slowly discarding the wisdom of the past, calling it outdated, primitive, or unscientific? The same pattern exists in modern science. We are told that today we have more knowledge, more technology, more achievements, and everything that came before is dismissed as folklore, alternative medicine, or even charlatanism. Yet here is the paradox. Many modern drugs are derived from natural substances, or designed to imitate them. So the real question is not whether we are progressing. The real question is, are we moving closer to wisdom or further away from it? Natural remedies have existed for hundreds, sometimes thousands of years. They have survived the ultimate test, time. And yet we constantly hear the same argument. This natural remedy has not been studied. But here is the uncomfortable truth. If a remedy does not generate profit, who will pay for the research? Around 80% of medical research today is funded by pharmaceutical corporations. And as a result, we see the rise of iatrogenic diseases, illnesses caused not by nature, but by medical treatment itself. Side effects, complications, long-term damage. There is also something called polypharmacy. This is especially common in nursing homes, where elderly people may take 10, 20, 30, sometimes even 40 different medications. At the same time, the most important factors are ignored. Doctors rarely examine lifestyle. They do not analyze diet, sleep quality, stress levels, gut microbiota, eating frequency, snacking habits, all the things that shape the root cause of disease. Instead, medicine often waits for dysfunction to appear, sometimes years later, and then treats the symptom. Preventive medicine exists, but it plays only a minor role in modern healthcare. Even the supplement industry is not what it seems. A large part of it is controlled by the same pharmaceutical corporations. They own vitamin companies. They are connected to food conglomerates, junk food manufacturers, and chemical corporations. We question the quality of many of these products. Even the most popular supplement in the world today is owned by a pharmaceutical giant, and that fact alone should make us pause and think. Let's take a closer look at one of the most popular supplements in the world, 1A-Day. Its very first ingredient is calcium carbonate. That is limestone. And as you know, ingredients are listed in descending order by quantity, which means this supplement contains more limestone than anything else. That is also why the bottle feels heavy. Along with calcium carbonate, it contains synthetic vitamins, fillers like maltodextrin, food colorings, and artificial flavorings. Now, to be fair, the side effects of pharmaceutical drugs are far more severe than the side effects of vitamins, minerals, and dietary supplements. But now, let's look back. Let's talk about remedies listed in the United States Pharmacopeia of 1926. You may find this shocking. Number 1. Cod liver oil. This was a common remedy used by physicians. It was prescribed for tuberculosis. It was also used for rheumatoid arthritis. Today we understand why. Cod liver oil is rich in omega-3 fatty acids, including EPA, a powerful natural anti-inflammatory compound. Cod liver oil was also combined with calcium salts to reduce minor muscle twitching and to treat neuralgia, most likely because it helped reduce inflammation. Number 2. Nutmeg oil. It was used for certain psychiatric conditions. In reality, nutmeg oil has narcotic properties. Eventually, it was replaced by synthetic psychiatric drugs. Number 3. Olive oil. It was used as a mild laxative for constipation. It was also used to address gallstones. And this makes sense. Fat intake stimulates bile production, and bile helps dissolve gallstones. However, this remedy requires caution. If a large gallstone is already blocking bile flow, a sudden increase in bile secretion can raise pressure inside the bile ducts and the gallbladder. Number 4. Pine oil. It was used to help expel mucus from the lungs. A few drops were added to boiling water, and the vapors were inhaled to treat chronic bronchitis. Number 5. Castor oil. It was used as a gentle laxative because it stimulates contractions of the large intestine and improves peristalsis. It was also applied externally for dermatitis and other skin conditions. Number 6. Sandalwood oil. It was used to treat gonorrhea, bronchitis, and bladder infections. This is because sandalwood oil reduces levels of E. coli and salmonella in the urinary tract. Number 7. Safflower oil. A drink known as root beer was traditionally made from the root of this plant. Safflower oil is a powerful antiseptic, especially effective for dental root canals. It was widely used as an antibacterial agent. Number 8. Betaine hydrochloride. It was recommended for a wide range of digestive problems, including bloating, indigestion, acid reflux, and heartburn. Betaine hydrochloride increases stomach acidity. It is a precursor to hydrochloric acid and helps destroy harmful microbes in the stomach. In the 1920s, it was commonly used to treat digestive disorders and poor digestion. Number 9. Pepsin. Pepsin is a digestive enzyme. It was used to treat digestive insufficiency. For pepsin to function properly, the stomach must be highly acidic. Enzyme activity depends on pH. Some enzymes work in an alkaline environment, but pepsin is activated only when stomach acidity is strong. Its primary role is the breakdown of proteins. Number 10. Lugol's solution. It is still used in modern medicine for certain preoperative procedures, but in the past, it was used far more broadly. It was prescribed for hyperthyroidism and to protect the thyroid gland from radiation exposure. When exposed to radiation, iodine is required to prevent radioactive damage to the thyroid. Number 11, magnesium sulfate, also known as Epsom salt. It may sound surprising, but in the 1920s it was considered a true medicine. It was used to relieve tension, improve sleep, reduce anxiety, and alleviate pain. It was also prescribed for depression. Many of these remedies had very few side effects. Over time, they were replaced by a wide range of pharmaceutical drugs. Number 12, calcium chloride. It helps increase acidity in the body. When the internal environment becomes overly alkaline, it can cause itching, allergies, and even trigger asthma attacks. Calcium chloride was used to restore proper acidity and reduce these symptoms while the root cause of alkalinity was being addressed. In some cases, magnesium can be recommended. However, when calcium is introduced in an acidic environment, it can also help relax muscles and relieve spasms. Number 13, liver extract. It was used to treat anemia. Liver extract is extremely rich in iron, vitamin B12, and other essential nutrients, all in one natural form. Today, we mostly use synthetic B12, and the iron found in many supplements is poorly bioavailable. In contrast, liver extract contains heme-iron and a highly active natural form of vitamin B12, which makes it far more effective in treating anemia. Number 14, methylene blue. This was one of the first synthetic medicines ever created. It is technically a synthetic dye, but it is produced very differently from modern chemical dyes and has a completely different structure. There are thousands of studies on methylene blue. In the past, it was used to reduce tumors, to treat meningitis, urinary tract infections, and gonorrhea. Today, interest in methylene blue is returning once again. It improves mitochondrial function, especially when mitochondria are damaged. Since mitochondrial dysfunction is a root cause of many chronic diseases, methylene blue can slightly enhance cellular energy production. Number 15, lithium carbonate. It has long been used and is still used today to treat bipolar disorder. In the past, people visited lithium-rich mineral springs and simply bathed in lithium-containing water. This had a calming and stabilizing effect. There was even a lithium-based soft drink, a lemon-lime soda. In low doses, lithium appears to help with anxiety and depression. However, in 1948, lithium was banned from being added to beverages. At one time, the drink 7-Up contained lithium. There are several theories about the origin of the number 7 in its name. Some believe it refers to lithium's atomic mass, which is close to 7. Others suggest it referred to the number of ingredients. Today, many people take lithium orotate, but in doses far smaller than those once prescribed by doctors, sometimes 100 times lower. Lithium is now mainly used to support mood stability. Number 16, Glauber's salt. It was used as a laxative to help remove toxins from the body. Number 17, vitamin D. In a medical textbook published in 1972, there is a description of using 280,000 IU of vitamin D3 for certain autoimmune conditions. Yes, you heard that correctly. In the next edition of the same book, the recommended dose was suddenly reduced to just 600 IU. Vitamin D has been heavily restricted over time. Today, many experts believe that most people require at least 6,000 to 10,000 IU daily simply to maintain adequate levels. Vitamin D performs a wide range of critically important functions. It supports mood and emotional stability. It is essential for every part of the immune system. Vitamin D can help relieve lower back pain that radiates into the legs and pelvic area. It is absolutely vital for pregnant women and infants, helping prevent abnormalities in bone and tooth development. Number 18. This substance cannot be named. Due to platform restrictions, no direct claims can be made about it. What can be said is that it was once used by official medicine before being replaced by antibiotics. Today, discussion of it is severely limited. Number 19. Activated charcoal. It was used for food poisoning, for excessive gas, and for binding certain toxins in the digestive system. Even now, activated charcoal remains one of the most powerful natural adsorbents. Number 20. Niacin. Niacin is vitamin B3. It is a natural substance known to lower triglycerides and increase HDL cholesterol. Numerous studies suggest that niacin may extend lifespan and reduce the number of cardiovascular events. Niacin has also been used in the treatment of psychiatric conditions, including bipolar disorder and schizophrenia. In addition, niacin is a precursor to NAD, a molecule essential for mitochondrial energy production. NAD is what allows mitochondria to generate cellular energy. And notably, niacin costs many times less than popular NAD supplements.